Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here in the studio at 866-870-5752, 866-870-5752. Call in today and get your free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy. And remember to check the website at www.lastemcells.com. And right
Robert, now, Dr. Marc Darrow, thank you for waiting.
Yes, hi. Thank you.
I just wanted, for the new listeners, I just want to mention your case. You've got, quote, bone-on-bone arthritis in your knee, and you spend time biking. How often do you bike?
Oh, probably every day.
Okay. So I mentioned before that you don't really have bone-on-bone arthritis. A doctor told you that. And that makes you think you need to have a meniscal transplant in your knee, which is a very major surgery as far as I'm concerned. I have personally never seen one work out with the patients who come in to see me. And, they're coming to me because it failed. So, of course, I have a jaundiced eye about it. I'm going to ask you a question. Why would anyone consider doing a major surgery that could fail, has a high failure rate, when they can come into my office and get injections with their own cells from their body, platelets or stem cells, and then walk out? So why would they? Tell me, what's on your mind? I mean, you obviously called my show because you're thinking there's something to do with regenerative medicine that might help you. You're curious about it.
Well, I frankly, I was flipping channels, and I thought, oh, okay, I better get educated.
Okay.
So I'm
good.
a person who likes to get as much possible information as I can to make an informed, decision.
Yes.
So again,
yes.
so far, the most important thing that I've been doing is, again, I lost 30 pounds, and I've been,
that's big.
doing a
That's
variety of
huge.
different
That's
exercises.
30. The 30 pounds you lost is 150 pounds of pressure on each knee. So that is the smartest thing that you've probably done your whole life. It's amazing.
No, exactly.
Almost every patient I have's got to lose weight. They don't like me for that, but it's the truth.
Yeah. So no, I am not aware of the regenerative. Although locally here in Los Angeles, Dr. Sun Xiong, who I guess kind of pioneered some of the stem cell research, so I am aware of that, but I haven't talked to anybody who was actually engaged in that process. So
okay, well, why don't you do this? Write this down: www.lastemcells.com. www.lastemcells.com. I've got endless studies on that website that describe the tissue growth process, how it works, how the injections work. There are also videos of me doing these procedures, so you can watch that, see if it's something that you prefer to do rather than getting your knee cut open, with chances of infection and failure and all that. Look, again, I say this during my entire show, I love orthopedic surgeons. I just don't think they should be doing all of these surgeries that don't need to be done. We have studies that show that fake surgeries, where the patient thinks they had a surgery, do as well as patients that have the actual surgery. So why get a real surgery when you can get a fake one and do as well? I'm being facetious.
I appreciate that.
Yeah, you don't have bone-on-bone arthritis, and I'll put up a bet, any bet you want, that I can help you with your knees the way you're describing them without you getting surgery.
Well, no, I appreciate that, and I will definitely educate myself. And just for your listeners, so whatever it is I have, it hasn't slowed my ski season down either. So last year I got in 15 days of skiing, and
Yeah.
no issues
You
there.
do
So
not have bone-on-bone arthritis.
I love it. Thank you.
Yeah. And look, I see x-rays and MRIs all day long with people that bring them in saying they have bone-on-bone, and I laugh. And
So
the
what would
patient
be-
goes, why are you laughing? I go, because you don't have bone-on-bone.
Well, let me ask then, what is that then from the person who took that X-ray to the person who made that description? What is
Yes.
the disposition? Is it just a job and money, or is it truly a misinterpretation of an X-ray?
Let me put it like this. If you're born in another country and you are trained to hate Americans, okay, Americans are bad, don't you think that that person believes that that is true?
Yeah, I'm sure they do.
There you go. There you go.
Yeah.
And I was trained the surgical route, and I was trained that surgery is just about the only thing that can help someone with orthopedic pain. And it wasn't until I went to a workshop in Las Vegas, it was like a 3 or 4 day workshop I went to about regenerative medicine during my residency at UCLA, and my wrist was injected and it was 50% healed the next day. And then I did my own shoulder, which I couldn't use at all, and the next morning I woke up 100% healed. It doesn't work like that on everybody in every case. It usually doesn't.
Right.
It usually takes a few injections to grow enough tissue. But to be honest with you, I thought that was God coming down and kissing me on the forehead saying, this is the work you're going to do the rest of your life. I did.
Well, I think God does work that way, actually. So, yeah.
Yeah, and I've been doing this work since 1998 with amazing success. It doesn't work on everybody, I'm going to be honest. And usually it's their fault. Usually they'll keep doing their sports or activity, or they'll quit before the work is done.
Uh-huh.
And then they say, no, it didn't work. My surgeon told me it couldn't work.
Yeah,
anyway, I think there's good hope. Yeah. Robert, good hope for your knee healing.
Well, I will go to the website, and I'm sure you'll be getting a call from me, so thank you.
God bless, man. I'd love to meet you.
Thanks for your call, Robert. The office number is 800-300-9300. That's 800-300-9300 if you want to just call the office. And our number right here in the studio, so you can call and talk to Dr. Darrow right now, is 866-870-5752, and we have lines open for you. And right now we're going to go to Ricardo in Montebello.
Hello, Ricardo. Dr. Marc Darrow, I understand that your low back is bothering you. How long has that been going on for?
Well, I've had the problem probably off and on, for some years, and, I kind of felt some tightness in the back, down in the bottom. And so, I normally try to do some stretching and so. But I had a little accident, won't go into that, keep it kind of short. And they did a CAT scan, and they found out that I had the thinning between the two discs. I guess they call it stenosis.
Okay. Well, there's two separate things that you're raising right now. Thinning between the discs is called DDD, degenerative disc disease. Okay?
Okay. So
I don't consider that a disease. That's just something that's kind of natural. As we age, we get shorter, right? We dry out. And people always ask me, how come when I'm older now, I get hurt so easy? Well, because you're drying out. That's basically what aging is about. So stenosis is something different. That's where this could be from stenosis that you're having this. But typically if someone has stenosis, spinal stenosis, they're going to either have pain down their arms or their legs, not necessarily in their neck or back. Okay? And that's another surgery that often should not be done. Just because someone has spinal stenosis doesn't mean they should get a surgery.
Okay.
So we had another inquiry on the radio before whose name was Arthur, and he had problems in his SI area, sacroiliac area, just like yours. So I explained that to him. That's usually what we call an enthesopathy. It's where the enthesis is, where it attaches to bone, where the ligaments attach. And I can tell you in 1 second by touching your low back, if you want to come in the office, the phone number is there to the office, is 800-300-9300. I'll repeat it for you while you're scribbling it down. 800-300-9300. And if I touch that area, I can tell you in 1 second the chances that I can help you without having a surgery. Most of these surgeries should not be done.
A quick question.
Yes, sir.
Between prolotherapy and PRP,
yes.
Just take the scenario that you just gave me. What would you do, or what would you use under just a hypothetical situation here?
Sure. Hypothetically is a great way to deal with things, but I'm going to deal with it realistically and technically.
Okay.
I have used prolotherapy. Is everything I do is prolotherapy, including stem cells. Prolo means proliferate, from the Greek term, to stimulate. And all we're doing is stimulating new tissue growth. All of the treatments I do stimulate new tissue growth. Prolotherapy in the vernacular refers to injections with sugar water for the most part, dextrose. It could also be things like sodium moruate, zinc sulfate, and other things that are caustic to the tissue. And what they do is they kill a layer of cells, create inflammation, and then sequester fibroblasts to the area where the injection takes place. Is someone in the background? Do you have a radio, or what's going on?
Are you driving?
Yeah, I'm driving right now, but I got it off.
Okay, thank you. So the bottom line here is what you're really asking is, can I use dextrose, sugar water? You still have interference going on, sir.
I got it off right now.
Thank you. Should I use sugar water to inject my low back with, or should I use my platelets? My experience on my body, because I've done both many, many times on my injuries, is prolotherapy. Okay, I'm gonna take him off the air, Anita.
Okay.
And I got it off right now.
I'm just gonna.
It off.
Okay, go ahead.
Okay. My personal experience is that prolotherapy is about 1/10 as valuable and strong and effective as using platelets from the blood. I had a knee injury many years ago that I injected about a dozen times with sugar water, dextrose. It always helped a little bit, but not enough so that I could sprint and run and hike and all that stuff, because it would loosen up again. My knee was actually loose from my 80-pound husky running into it full speed. And then I did one PRP treatment, and it tightened it up, and it has been good forever. Forever meaning several years. So whenever the choice is there and patients say, I'm here to get the dextrose injections, I go, you don't want it. It's good, but it ain't great. And the variable is from sugar water, dextrose prolotherapy, to PRP prolotherapy, to stem cell prolotherapy, in that order. So depending on the severity of the injury, will depend on what I suggest. It's always the patient's choice. I still have patients come in who beg me for dextrose prolotherapy and don't want their platelets for whatever reason. It may be a religious reason, and don't want their stem cells, and we will still do dextrose prolotherapy. Okay, Ricardo, I hope you're still listening to that. And let's go on to Mary Ann after we give out the phone number to the studio to talk to me personally. The phone number here, talk to me, is 866-870-5752. I'll give it out one more time, 866-870-5752. And if you want to just call the office and find out more detailed information, you can call 800-300-9300. And if you want to go to my website to watch me doing these procedures on videos that I've done or read the research on it, the website is www.lastemcells.com. You can email me from that site. Should we go to Marianne about her back and her neuropathy?
Let's do it.
Marianne, Dr. Marc Darrow, how are you today?
Hi. Can you hear me?
No, I cannot.
Hello?
You're going to have to scream into There you go.
Oh, hi, Dr. Darrow. I'm actually calling from my husband, who has had back pain for many years. And I've listened to your program before, and that's why I'm calling. And also, he has tingling in his feet, the bottom of his feet. And he's had the blood test, and he doesn't have diabetes.
I'm going to disagree with that right now.
Oh, really?
Okay? The reason is, do you know what his hemoglobin A1C is?
I think it's 5.6.
Okay, he's on the edge. Is he overweight?
No, he's very thin.
He's thin? Okay, that's good.
He had actually 2 tests.
Okay.
For that.
What's fasting insulin?
No.
What was the other test?
Can you turn that down because I can't hear? Hi. I'm sorry, what was the question?
What was the other test he had?
Oh, well, he had to see his doctor, a yearly checkup, and they did a whole blood test, and then he also went to Life Extension and had a blood test scheduled a day or two later.
Well, if you would like to get a hold of me through my website, you can email me and give me more information, and you can send me his blood tests and all that. I'll look at that and give you a call, okay?
Okay, that would be great.
The tingling in the feet still can be a neuropathy even if he doesn't have diabetes. The 2 main causes are diabetes and alcoholism.
No, he doesn't drink. He's a meditator, and he doesn't drink.
Sounds like me. Good. Did he ever drink?
Not really.
Okay. Did he have an EMG and nerve conduction study?
Well, he did have an injury on his foot. No. It's hard to hear. I'm so sorry.
Okay, I'm doing my best here. There's a test he can
get.
get.
After the show?
Sure, help yourself.
Okay.
Just call the office, 800-300-9300.
I have it. Thank you so much.
Okay, God bless you. So I'm going to keep talking about your husband, Marianne. There is a test called an EMG, that's electromyogram, and an NCV, which is nerve conduction study. And those tests should be done to check and see if it's actually a neuropathy, or it could be a peripheral nerve injury from, I heard Marianne say that he did have an injury to his foot, so one of the nerves could have been tweaked. And I've had that happen on me, where I've had things fall on a nerve, and the nerve just keeps barking for months. If that happens, B6, about 50 milligrams, can help the myelin sheath around that nerve heal up so that the tingling or irritation can go away. So the back we didn't get to in terms of your husband, Marianne, but most back pain I can help, not all of it. There are times when there is a giant herniated disc pressing on a nerve, or a facet that is arthritic that's pressing on a nerve, and I can't help that. But a lot of times those things are not the problems, and I can help the things that are not the problems. A lot of times people have herniated discs, and that's not the pain generator, and we can help them too. So it's questionable when people come in with a certain diagnosis whether that diagnosis actually is the pain generator. And in my experience doing this, just because a patient comes in with a diagnosis from another doctor, it does not mean that that is the problem. So be very careful not to get a surgery based on a doctor's diagnosis. It's always safer to see a doctor who does regenerative medicine to see if they can help you, because instead of doing a surgery, you're going to get some injections. So you need informed consent. A lot of patients that I have come in, I will send to an orthopedic surgeon or neurosurgeon if I think that they need more informed consent than what I have. I just sent a patient of mine who had some knee problems to an orthopedic surgeon because he had tears on the quadriceps tendon. And because I don't do surgery, I wanted that opinion. I wanted that doctor's opinion. I did inject the patient's knees with stem cells. One time he came in, I forget what it was, he was like 40% better or so, which means the problem was not the tears in the quadriceps tendon because I didn't touch that. All I did is go inside the knee. At any rate, we have to do a good examination. We have to have doctors stop relying on images to decide if they're going to do surgery. Most of the patients that I come in that have failed surgeries, I ask if their doctor touched them. They say no. Well, what'd they do? Operate on an MRI or an X-ray? That's kind of silly to me. You don't operate on images. You operate on or try to heal patients. So let's go to William. He's got an ankle that's bothering him. Hi, William. Dr. Marc Darrow. What's up with your ankle?
Hey, good morning, doctor. Yeah, I am 62. 10 years ago, I diagnosed with no cartilage left in either one of my ankles. So
okay.
I've seen X-rays, and they did an MRI, and they showed me a healthy ankle with cartilage, and they've shown me mine, and visually you can see there's no cartilage left between the bones in both of my ankles.
Okay. And?
I've seen a couple of orthopedic guys, and I've gone through a couple of podiatrists, and, the suggestions there will fuse the bones together. Or that there's no surgery to surgically implant, cartilage or grow new cartilage.
Okay.
So I'm not sure what to do. It's been 10 years.
Okay. William, what's your activity level?
It's high. I'm a contractor, and I used to play a lot of sports. And as far as activity now, I snow ski because I can strap my ankles down in a ski boot, and it doesn't move. So I can ski all day long without any pain. But
can you walk?
Walking in the sand or walking in general is painful every day. I have my podiatrist gave me a couple of braces. I bought some braces, so I have braces on my ankles now.
Are you doing any sports at all?
No, I'm not doing any sports at all right now.
Are you walking?
Too painful.
Do you walk? Do you walk on your... Okay.
I can walk, but I look like an old man. I look like I'm years older than I am.
Well, you are an old man. I'm just teasing. I'm 10 years older than you are, and I'm very active sports-wise. So let me tell you my experience. Oh, darn it. Get to us at the office, 800-300-9300. Go to the website, www.lastemcells.com. I have very good hope for you using your platelets or stem cells to make you feel a lot better and get
we're out
rid
of time,
the pain
Dr.
in your ankles.
Darrow. Thank you so much. Thank you, Alex. Thank you, Suzette. Write this information down. Remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday, and we'll see you next time.
To Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.